The birth of a baby is one of the most joyous and exciting times of life. But for a surprising number of women, having a baby can trigger a debilitating and often frightening condition called postpartum depression. My next guest can relate to that. Take a look.
My life was turned upside down after I gave birth to my son. I really didn't feel like myself anymore. I first noticed I was very paranoid that somebody was coming to take my son. I was anxious all the time. I absolutely thought I was crazy. I had a hard time bonding with my son. I felt nothing for him. I was very nasty to my husband. I hated him, and I had no reason why.
He just started screaming, just went off on me, told me to get out. That hurt.
The symptoms were so bad that it almost ruined my marriage. My lowest point was I got in my car, I started driving home, and then I got to the bridge. And I don't know what happened. I realized I was trying to drive my car off of the bridge. I was officially diagnosed with postpartum depression 4 months after my son's birth. I have a horrendous fear of having more children. I'm just too scared to go through the nightmare of postpartum depression again.
Well, the big issue, and Lisa is here with us, and also joining us is our good friend, Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer. Welcome, both of you. When did you first begin to notice what you now know to be signs of postpartum depression, and what was happening?
I started having numbness feelings. I didn't really feel anything. I didn't feel nothing for my son, my husband. And when I went to my midwife for help, she had said that I was the worst case of postpartum depression that she'd ever seen.
Okay, so numbness, you mean you just felt bland, just dull emotionally?
I felt nothing.
Okay. How can a new mom tell if she's feeling anxious or overwhelmed, usually called the baby blues, but how do they know if it's more serious?
About 80% of women after the birth of their baby will go through what we refer to as some form of the baby blues. And that's when a mom will experience sadness, anxiety, maybe tearfulness, difficulty sleeping. But this should only last about 2 weeks. But postpartum depression is much more severe, much more intense, and lasts longer. So the duration is a very important part of it, and the severity, the deepness of what you're feeling is also really important. What's happening is a form of clinical depression that occurs in about 10 to 15% of women who give birth.
So during your postpartum depression, what happened that alerted you to a problem?
The bridge scenario was the cue that something was really wrong. I was having a lot of suicidal thoughts before that, but I started having vivid hallucinations of driving my car off of the bridge.
Any suicidal thoughts is a very serious symptom of postpartum depression and requires immediate medical attention. Women often with postpartum depression experience things like these extreme mood swings back and forth. They have difficulty bonding with their baby. They may push family members and others away, withdraw from them, and experience extreme anxiety, anger, and a lot of guilt. A lot of women feel ashamed about this, but postpartum depression is a serious illness, as you've experienced, and so medical care is really important to get right away.
One thing I want to say about asking for help is don't be afraid that they're going to take your baby away from you. That's not the case. You'll get help. They'll give you the support and the things that need to happen. Do we know what causes postpartum depression from a medical standpoint?
So we don't know exactly what causes it, but we know that there are extreme shifts in hormones and in kind of the physical body that's happened during pregnancy, during birth, and after. And we think that combined with the stress of taking care of a newborn baby is enough, right, that interplays together to create the situation. Right. And I also want to add a risk factor that is really important, and that is if you have a history of depression, your risk increases for developing postpartum depression.
Given the severity of your reaction, you say you and your husband are worried about having more children.
We want to have more children, but I'm terrified of having recurrent postpartum depression episodes again.
What are the chances it's going to happen in subsequent pregnancies?
So studies tell us between 25 and 50% of women who have postpartum depression will experience or can experience a reoccurrence of that depression in a subsequent pregnancy. But If you know that is information, then if you're thinking about getting pregnant, or if you are pregnant, you can talk to your healthcare team and work with them to develop a treatment plan that may reduce a reoccurrence of postpartum depression. And that treatment plan can include things like counseling, a very regular screening for depression, and it could include medications.
Because you felt pretty alone with this before.
Absolutely.
So where can women get additional information about postpartum depression?
On gethealthystayhealthy.com, we have stories from women like Lisa who are courageous and have shared their stories about postpartum depression, and along with some management tips on managing postpartum depression and some links to resources like support groups. And of course, while you're there on Get Healthy, Stay Healthy, you can sign up for a monthly newsletter, and then you can just get information that comes directly to you in your inbox.
What I like about it is it's not all theoretical. There are really good action steps there. Whatever disease, disorder, whatever you're looking at, they're really usable action steps. I want to thank all of my guests today, especially Dr. Freda Lewis-Hall.